Okay, well, thank you all for joining us. We will be discussing mind, body, and its relationship with fertility, specifically how stress, nutrition, and sleep can affect conception. I'm joined today by Dr. Leah Eradat. We're excited to have her. So we have a lot to go over. So next slide, please. Mhm. So, my name is Dr. Susan Maxwell. I am a board certified OBGYN and reproductive endocrinologist. I work primarily out of our facility in Santa Barbara. Um, I completed my training at New York University, both my residency and fellowship. And I worked in New York for about 5 years before moving to California and joining SCRC in Santa Barbara. Mhm. Next slide. Mhm.
Hi, I'm Dr. Leah Eradat. I'm an acupuncturist with SCRC, working primarily out of the Beverly Hills office. I'm board certified with my master's and doctorate both done in reproductive health and women's fertility. And I'm also part of the board of acupuncture and reproductive medicine called ABORM.
Mhm. Okay. Next slide. Mhm. So at SCRC, we are very proud of our proven track record of more than 25 years of experience in fertility. We have two state-of-the-art embryology laboratories. Our main location is in Beverly Hills, but we also have a small laboratory up in Santa Barbara. We have surgery centers at both locations where we do procedures, and we also have satellite offices in Pasadena as well as Ventura. Mhm. What really sets us apart is our state-of-the-art embryology laboratories. They are run by a very experienced laboratory director, Dr. Kathy Miller, who is world renowned. We do double witnessing verification at both locations. We freeze samples, eggs, sperm, and embryos using vitrification, which is a flash freezing process, which has really improved survival and pregnancy rates over the years. We are also very experienced in blastocyst biopsy, and we have been performing embryo biopsies for many years for the purpose of genetic testing. We do screening for aneuploidies, and we can also test for single gene disorders with PGTM. We also have the advantage of having embryoscopes at both of our locations. This is time-lapse imaging of embryos as they developed, and it's a closed culture system, which really helps improve embryo development, and then we can see in real time what is going on. Next slide, please. Mhm. So today we'll be going over what can impact fertility and discussing holistic approaches to fertility and how you can really optimize your chances of conception. And then specifically acupuncture and the role of acupuncture in fertility treatments. Mhm. Next slide. Mhm. Okay. So there are many different things that can affect your fertility. And when you come in for a consultation, we get to know you and we do a workup and try to identify if there's one specific area that is contributing to why you may not be conceiving. Age is a huge factor because egg quality declines with age, meaning the ability of an egg to create a genetically healthy pregnancy. There are hormone imbalance disorders such as polycystic ovarian syndrome. And with this condition, women have a lot of eggs, which is very positive, but that hormone imbalance can prevent ovulation or consistent ovulation. Endometriosis is a condition where endometrial glands can be growing on the ovaries, fallopian tubes, or surfaces of the abdomen, and this can cause inflammation and scar tissue. Um, General health, medical conditions, obesity, high blood pressure, diabetes, cancer can all affect fertility. prior pelvic infections can block or damage fallopian tubes. And then, in addition to weight, exercise, and toxins can have an impact as well. Next slide. Mhm. So this really goes back to your fertility being based on multiple factors and lifestyle having a huge impact. And as our lives become more busy, and our diets suffer, and we become more sedentary, all these things can impact our ability to ovulate and our hormone balance. And so, prioritizing your health and really looking at all different aspects of your life can be very beneficial. Mhm. Next slide. Mhm. So this is why we believe at SCRC in a holistic approach to fertility, and we look at factors such as nutrition, the role of acupuncture, and different stress relieving techniques such as meditation or just exercise and being able to get a good night's sleep. Next slide. Mhm. There are many benefits to nutrition. What we eat gives us vitamins and minerals and proteins that are important for reproduction. Eating enough protein in your diet has been associated with better egg quality. And so we want to be sure that patients are eating healthy, lean proteins and not too much sugars. Diets such as a Mediterranean diet with plant-based foods such as whole grains, vegetables, legumes, fruits, seeds, and nuts can be helpful. It's not one diet is not for everybody, but I think in general, eating whole foods and avoiding processed foods, which contain a lot of added sugars, chemicals, can be important. Folic acid is very important for early fetal development. This can be found in legumes, dark leafy greens, and we do recommend folic acid supplementation, which is in your prenatal vitamin. Vitamin B12 is important. This can be found in organ meats, also in your prenatal vitamin. And then omega-3 fatty acids can be found in fish, like salmon, cod liver oil, or in supplements as well. Next slide. Mhm. So for all patients who are trying to conceive, we recommend a prenatal vitamin that has at least 800 micrograms of folic acid. And this can improve fertility, live birth rates, and just helping with early fetal development. CoQ10 is a potent antioxidant, which has been shown to be beneficial for egg and sperm quality. All antioxidants are helpful for fertility, whether you're getting them in your diet with berries or acai, but CoQ10 is a great potent form that you can buy as a supplement. Vitamin D, many of our patients are deficient in vitamin D, and is some association between vitamin D deficiencies and poor outcomes with IVF, as well as miscarriage. Mhm. Next slide. Avoiding toxins is very important. We're seeing a lot more patients using cannabis, and this is having an impact on sperm and egg health, but also there has been increasing research that children conceived while parents are using cannabis increases the risk of neurodevelopmental issues. And so we recommend stopping cannabis several months before conceiving. Alcohol also decreases pregnancy rates, especially if you're drinking heavily at the time of ovulation. And then tobacco is also harmful for egg quality, reducing egg reserve, and leading to low birth weight. Next slide. Um, is very important for regenerating your cells. It's difficult to measure, but if you're not getting enough sleep, this increases your stress hormones. Um, and getting enough sleep just helps with cellular repair, and reducing stress and inflammation. So making sure you are getting a good 8 hours of sleep a night is important. Next slide. Managing stress, I find in my patients, is very important. Again, it's hard to measure, but what I find is if you have a lot of different stressors in your life, it becomes additive. So to tell somebody to get rid of all their stress is not realistic, but if you can identify specific things that are increasing your stress and then working to reduce each one of those can be very helpful. Even over exercising can significantly stress the body, or being underweight from not eating enough calories or over exercising. And so I find when patients do work to reduce their stress levels, we do have more successes with responding to treatments, and pregnancy rates. Next slide. So there are multiple ways to approach stress relief. Um, Acupuncture can be beneficial with that, and we'll get into that. Beyond that, sometimes just having a community and being able to talk about fertility issues, whether that's through support groups or therapists or friends, just having that emotional support can help you manage that stress. We talked about sleep, moderate exercise, but not over exercising, can all be important. Next slide. Okay.
Thanks, Dr. Maxwell.
You're welcome.
So, acupuncture is really important in fertility. We use it for many things, obviously, to support patients through maybe IVF, IUI, or even just trying naturally. But basically, IVF at its function, or acupuncture at its functional level, will increase blood flow to pretty much the whole body, especially the reproductive organs. So we're looking at better blood flow in the uterus, better blood flow through the fallopian tubes, your ovaries, and that's beneficial for so many things. We can also help regulate hormones, help regulate ovulation at that point, regulate your menstrual cycle. So sometimes we have patients who come in who have PCOS and have irregular cycles. Acupuncture, herbal medicine, changing your diet, your nutrition can kind of help all of that. We can also help with, endometriosis can cause some cramping, maybe some pain, reducing side effects of some of the medications that our lovely doctors will have you put on, and supporting you through hopefully a successful pregnancy. Next slide, please. So, acupuncture, we practice a form of traditional Chinese medicine, and we put very small needles. They're not like the blood draw needles, very thin, small needles into specific points on the body. And we do that after taking a look at your, tongue, your pulse, listening to your symptoms, what's going on, what your goals are, most importantly, and coming up with a plan. Usually I see patients at least once a week to start out with when we get closer to what I like to call like our goal day, which is maybe an embryo transfer or an egg retrieval. Maybe we'll see each other a bit more often if we need to. And then everything is personalized. So we make sure that the treatment matches what your body is presenting for and what your goals are. We spend about an hour together. Sometimes the first initial consult and treatment is a bit longer. We're pretty thorough. And then when you go home, it's just really nice. It's like a pre-nap to like your evening routine usually. Next slide, please. So we kind of talked about how acupuncture can help menstrual cycle the hormones. We have seen studies that show that we have an increased follicle count and an improvement in egg quality. That's not acupuncture alone. We do talk, like Dr. Maxwell said, thoroughly about nutrition, usually put you on a fertile foods diet, which is really rich in omega-3s, folic acids, kind of like we spoke about before, maybe even foods to support a luteal phase like bone broth, or if we're preparing for an embryo transfer, we have, you know, we use pomegranate juice or watermelon juice, as we've seen in certain studies. With acupuncture, we also improve blood flow to the reproductive organs. We can also help, which is really great. We see really, really quick results with sperm issues, DNA fragmentation issues, sperm count issues. And so, yeah, also great for helping with embryo transfers, of course. So, a significant study has shown a 16% increase in embryo implantation with acupuncture before and after an embryo transfer. So, that's definitely something that we offer on site at the Beverly Hills office. And then lowering stress, anxiety is kind of the cornerstone of what acupuncture does, in addition to reducing cortisol and lowering inflammation in the body. Next slide, please.
Okay, next slide. So what can impact your IVF cycle outcome? Well, this is hard to summarize into one slide because there are so many factors that go into having a healthy pregnancy. We see a lot of issues with embryo chromosomal abnormalities, and an embryo that is not genetically normal oftentimes will not implant or make a pregnancy. So that's why we do a lot of genetic testing now in our patients who are doing IVF, where we biopsy the embryo to screen for abnormalities, and then we preferentially transfer the healthy embryos. This alone has improved implantation rates significantly. Other things, so getting that healthy embryo can be difficult. And so we really want to tailor your treatment plan to your own characteristics and try to get you to produce a healthy number of eggs during your IVF cycle, so that we are able to find healthy embryos and have a good outcome. Sperm quality, we initially assess patients with a semen analysis and then see if there are any issues that need to be addressed. And sometimes lifestyle modifications are made to help sperm quality, or we refer to urologists, which can do an in-depth physical exam, hormone testing, and see if there's any procedures that are needed. I find it really interesting that acupuncture can also have a role with sperm or
Yeah.
improving sperm health. And that's something I'm learning today because I don't often think to refer my male patients for
Yeah.
acupuncture. So that is a really good tip because um, blood flow to the testicles impacts sperm counts and motility. So that it really makes sense that acupuncture
It
could have a
does.
role there. Mhm.
I always get so excited when I have male patients come in. They don't usually come in because they don't like needles, and so their wives usually have to convince them to come in. But when they come
Mhm.
in, I'm like, couple treatments, we'll see, usually a big, within 3 months, usually you see kind of a big change, and I think that's so exciting.
Yeah, that's fascinating. Um, other, so we talked about lifestyle factors as well. Okay, next slide. Mhm. So we employ different treatment options. So IVF is just one treatment for infertility. Other treatments are ovulation induction, where we give pills to take for 5 days at the beginning of the cycle to try to stimulate ovulation, but also more than one egg to ovulate sometimes, which can improve pregnancy rates. With that treatment, we sometimes utilize IUI, intrauterine insemination, which can help to concentrate sperm. We get rid of dead sperm, concentrate into healthy sperm, and then put it in the uterus. So that's closer to the egg. We also do treatments at SCRC using donor gametes. So we have patients using donor eggs to conceive, donor sperm, donor embryos sometimes. And then some patients are using gestational carriers. So if they're not able to carry a pregnancy themselves, their embryo could be transferred into a gestational carrier. Okay, next slide. Mhm. The IVF process is a 2-week process and approximately 2 weeks. And you come in either with a period or we have you on birth control pills and you come off the pills and you come in for an ultrasound, baseline ultrasound and blood work. We then start you on injections, which you take every day for 10 to 12 days. And while you're on those injections, you're coming into the office every few days for blood work and ultrasounds so that we can adjust your medications. Approximately 2 weeks into the process, you would be ready for your egg retrieval. And this is done at one of our surgery centers, and you get anesthesia, so you do not feel anything. Next slide. So this is a diagram of the egg retrieval, and we use a vaginal ultrasound, and we have a needle attached. And that needle goes through the vaginal wall directly into the ovary, and we suction out the fluid pockets on the ovary. And these are what we call follicles. And inside the fluid pockets should be an egg. And so we suction out the fluid. This fluid gets passed directly to our embryology lab, and they look at it under the microscope to identify the eggs. This procedure takes about 15 to 20 minutes. Afterwards, you go to the recovery room for about an hour, and then you're able to go home the same day. Next slide. So on the day of retrieval, your partner would also come in to give a sperm sample so that we can fertilize those eggs in the laboratory. There are 2 different ways we fertilize eggs. We can mix sperm and egg together in the dish and let them fertilize naturally. Or we can do what's called ICSI. So this is a video of the procedure of intracytoplasmic sperm injection, where we take one sperm and we inject it directly into the egg to help with fertilization. And this is especially helpful in couples who have low sperm counts or motility. Next slide. Once the eggs are fertilized, they go into our incubators, and we call the embryoscope, and we do time-lapse imaging of the development. So we see them going from a fertilized egg to a 2-cell embryo, 4-cell, 8-cell, 16-cell, and then eventually they get to be about 100 cells, and this is called a blastocyst. And at this stage, we can do a biopsy of the embryo, which you're seeing here, where we take a few cells from the outside of the embryo to do a genetic test. The embryo then gets frozen while we await those results. Next slide. These are images taken from our embryoscope, and you can see how this embryo is dividing and growing. And it happens very quickly over 5 to 6 days. Okay, good. Next slide. Once we've identified a healthy embryo, then patients undergo the embryo transfer cycle. And this may involve taking hormones for estrogen pills for 2 weeks, and then we start progesterone medication, and then we thaw and transfer the embryo. We also sometimes do natural cycle transfers where we facilitate a patient ovulating so that the ovary then produces natural estrogen and progesterone, which helps to support the pregnancy. Okay. A donor, oh, we're having an information night, it looks like, on February 19th from 5 to 7 p.m. at our Beverly Hills office. So you can check that out on our website. Okay, next. So at SCRC, we have five physicians. Dr. Mark Surrey and Dr. Hal Danzer are the founders of the practice. They both work primarily in Beverly Hills, but Dr. Surrey's also up in Santa Barbara with me a few days a month. Dr. Carolyn Alexander and Dr. Diana Shavkin are also in Beverly Hills, and Dr. Shavkin sees patients in Pasadena as well. Mhm. If you'd like to schedule a consultation with any of us, you can call the office and then we can go through your information and learn a little bit more about you. If you have any questions, we'll now open it up to a question and answer session.
Thanks, Dr. Maxwell. That was really, really
Yeah.
great.
Well, thank you for coming. Let's see here. So the first question is, do you guys offer DNA fragmentation testing? Um, yes, we do. So this is facilitated through our andrology department. We up in Santa Barbara, we use company where they send you a kit, collection kit. And you produce, you put it in the mail, and then we get our results. But yes, we are able to do DNA fragmentation testing. Mhm.
In Beverly Hills, I believe you do on-site, and Desta either sends it out or they do it. I believe he's trying to bring it in-house, so they're working on
Right
it.
now. Yeah, okay. Um, for the DNA fragmentation test, would we have to have a consult first? Yes, whenever we're ordering tests for a patient, you have to have established care at our facility. And so that involves an initial consultation. Mhm.
Good question.
Mhm.
Okay.
I don't know if there are any more. Oh, wait. What is a kitchen sink protocol? I have no idea, actually.
Um, I think I can actually answer this
Yeah,
one.
you do. Okay.
Yeah, so if you're on the internet too much, which a lot of my patients are, and
Mhm.
sometimes we get the wrong ideas, we always want to do what our doctors recommend. A kitchen sink protocol is usually kind of throwing maybe like an intralipid infusion or doing like a prednisone steroids to kind of support a transfer from what I've read online. But we always want to listen to what our doctors say. They really want what's best for, you as a patient. So whatever their recommendations are generally going to be what's best. Uh,
Seen endometriosis patients deal with recurrent pregnancy loss. Um, so what I find with endometriosis is there are different degrees of endometriosis, and the location of the endometriosis can really impact what types of infertility patients have. Um, Endometriosis that is in the uterus, in the muscle of the uterus, this is called adenomyosis, can have a significant impact on recurrent pregnancy loss because it causes a lot of inflammation within the uterine lining. Um, and so endometriosis alone doesn't necessarily contribute to recurrent pregnancy loss, but there are certain types that make you at higher risk of miscarriage. Mhm. The most common cause of recurrent pregnancy loss is chromosomal abnormalities within embryos. And so the chance of having recurrent miscarriages increases as women get older and egg quality goes down. So oftentimes a treatment for that is to do an IVF cycle and test embryos, do genetic testing, because then when we transfer a genetically normal embryo, it significantly reduces the chance of miscarriage. Mhm. Okay, but what if the products of conception was normal? What are your thoughts on the receptiva test for endometriosis? Um, so, this is hard to answer without getting the full picture. And I'd encourage you to schedule a consultation so that, we can look at what's going on, do an ultrasound, look at your uterus. The Receptiva test is an endometrial biopsy that looks for markers for endometriosis. If we're doing endometrial biopsies for recurrent pregnancy loss, we also usually look for chronic endometritis, which is an inflammatory condition, and which could be associated with different bacterial colonization. Um, but if the products of conception was normal in that case, then it was less likely a genetics issue. Sometimes genetically normal pregnancies just miscarry for unknown reasons, and it could be that the pregnancy was not developing normally or was not implanted correctly. Mhm, mhm. Okay. Well, if there aren't any more questions, we will conclude our webinar. But again, if you'd like more information, you can feel free to schedule a consultation with either myself or Dr. Eradat. Mhm, mhm.
Thank you, Dr. Maxwell. Thank you all for
Thank
coming and
you.
listening.
Mhm. Okay, have a good night. Mhm.
Bye.